Hi, everyone, and welcome to your lecture number 2 for the Healthcare Principles 1 class. And this is Carol Vilches, and I am excited to give you guys this lecture. This is going to be chapter 1 on healthcare industry and your role in the healthcare industry. All of you guys were asked to get this book, Professionalism in Healthcare. And again, as I said to you in lecture, this is a very straightforward class. We discuss a lot of different case scenarios and professionalism. And the reason why we do this very early on is because we want to prepare you to pretty much work alongside other healthcare professionals. Some of you guys come in with some work experience and some don't. So we figured we would give you guys this lecture right away because you do get your feet wet in the lab right away as well. So I hope you enjoy these lectures. And again, don't forget that at the end of this course, you are assigned a case study, and you will present that case study. It should be about 5, 6, 7 minutes overall, and then we'll discuss all together. Okay, so here we go. Welcome to chapter 1, and I really like this quote here by John Naisbitt, international best-selling author. In a world that is constantly changing, there is no one subject or set of subjects that will serve you for the foreseeable future, let alone for the rest of your life. The most important skill to acquire now is learning how to learn. And that is so important. And I think that for us in education, as teachers or professors, we do have a love of learning and advancing our knowledge, expanding our horizons. But that shouldn't just be a skill for educators. It should be a skill for everyone, especially people that work in the healthcare field. Healthcare is always advancing and constantly changing. Everyone's field within healthcare, like nursing, if you're a physician, if you're an EMT, if you're a PA, if you're a PharmD, if you're a physical therapist, especially if you're an MLS, if you're a medical lab scientist, new tests are constantly coming out. You have to bring in a new instrument. You have to understand the way a condition works so that you understand why the testing is done a certain way. So learning constantly is a very important skill to have. And I think for the most part, all of us have it. We have this eager motivation to keep learning. Okay, so these are your chapter objectives. When you have a chance, go through them. Again, I like you to study by looking at these chapter objectives and making sure that you can answer and you can basically test yourself by answering the questions of these objectives. And keep in mind that when we make an exam for you, what we're doing is we're looking at these objectives and we are building our questions based on these objectives. So if you can go back and use them as review questions, it is great if you can do that. Okay, so that's 10 objectives for this lecture right there. So working in healthcare, what does that mean for you? Working in healthcare can offer you lots of benefits and opportunities. People always say, if you work in education or healthcare, you will always have a job. And I find that to be very, very true. Personally, my choice of going into the healthcare field has been one that I will never, ever regret. I have told you guys my story a little bit, but I decided to go into medical lab science when I was a sophomore in college at Fairleigh Dickinson University. And I did work in the field. I worked in 2 different places as a medical lab scientist. And then early on in my career, I transitioned to academia. So I taught for a university for a very long time. And so being a healthcare worker actually gave me the opportunity to transition into teaching, into academia. But it'll give you a wealth of opportunities. And I always say to you, it is medical lab science, a great career to have. It's great if you decide you want to do this and that's what you want to do, but it's also great as a foundation to something else. We've had many students that want to move on to medicine, to another student that would love to be a PA. At Rutgers, I have plenty of students that have applied to medical school right after they've done the medical lab science program, pharmacy school, PA, nursing, etc. So working in healthcare does provide you with lots of opportunities in terms of where you can go. As a medical lab scientist, just because you have your medical lab science degree doesn't necessarily mean you have to work in a hospital lab. You are gaining the skill to work in a lab, which means that you can work in any laboratory. So you can work in industry, you can work for a different types of pharmaceutical company, right? So you could also work in cosmetic labs. You can work in a vet lab, okay? So just make sure you keep that in mind. It's a great career to have. It's also giving you this knowledge and this skill that you can take anywhere you want, okay? So if you have any questions about other things that you can do with your degree, you should let us know, because we can try to help you. Okay, so it offers you many, many opportunities and benefits. Every time you get a job as a healthcare worker at a hospital, you better be sure that you're gonna get very good benefits. And by benefits, I mean, what do they offer you in terms of your 401k? What do they offer you in terms of your health insurance that can be for you or that can be for your family as well, and other benefits as well, like pensions. And a lot of hospitals offer child care benefits, discounts on health related benefits, and things like that. Okay, so turning into the next page. Job opportunities both now and in the future appear excellent, okay? Healthcare employs about 10% of all American workers. Through 2018, healthcare will generate more new jobs than any other industry. It offers diverse employment options and career advancement opportunities. So let me just stop right here. So obviously this PowerPoint presentation is a little bit old, and things may be a little bit different now. We have just been through a very serious, and we're still in the middle of it, a very serious pandemic, right? And so because of the pandemic, many hospitals are now in a very serious financial situation. So as far as hiring goes now, perhaps it may slow down just a tad bit. Maybe some people are getting laid off or going on furlough. It depends on the hospital. Luckily, a lot of us in the laboratory still were able to keep our jobs because of the pandemic. But in general, if this didn't happen, healthcare, work in healthcare does give you lots of job opportunities, and these opportunities are and do appear excellent. And as is stated in this PowerPoint, about 10% of all American workers will be employed by healthcare. Okay, so overall, oh, let me see, 1 second. Am I in the right? Okay, where's 8? Okay, just make sure I didn't skip something. Okay. So, overall, employment of medical lab scientists and technicians, medical lab technicians, is projected to grow 13% from 2016 to 2026. And that is faster than the average for all occupations. An increase in the aging population is expected to lead to a greater need to diagnose medical conditions such as cancer or type 2 diabetes, all of it through laboratory procedures. Okay, so in healthcare, it is also very important to become multi-skilled. So it is important to get cross-trained to perform more than one function, often in more than one discipline. In the medical lab science field, specifically, it is very nice when an employer can hire someone who is a generalist. So a generalist is a medical lab scientist that can perform the duties in either, well, in all of these areas. So you could pretty much perform everywhere, but a generalist is mostly referred to someone who can work heme and chemistry, basically like the core lab for that specific hospital. So a generalist would be cross-trained between one department and another. So hematology and chemistry, there's some cross-training there. There are people who are true generalists and they work everywhere in the lab. So you can have them work in hematology or chemistry, or they can also work in blood bank as well. So being multi-skilled and having the ability to get cross-trained from department to department is very beneficial. And also it makes you more marketable. So if you can actually go to a hospital and say, hey, listen, I've been trained in hematology, micro, blood bank, and chemistry, that's a plus for you. So they'll probably look at you, at your resume, and look to bring you on rather than somebody who's only had experience in blood bank per se. Okay, so working in healthcare is really a privilege. The opportunity to improve the quality of people's lives is there, and I can't stress this enough. I know that you guys are going to work in the lab, and a lot of people really want to work in the lab because they say, well, I'm going to work in the lab because I don't really want to deal with people. And so I just want to do my lab work, punch in and punch out, and then go home. No, that's not really going to happen in this in this case. You are actually working, you're working up a real patient. And I want you to keep in mind that this is a patient who has a family. Okay, this is a patient who has kids, who has a mom, a father, uncles, aunts, cousins. So people care for these people. Okay, so just imagine blood work being done for your parents, for your kids. So who do you want to do the blood work for your family, right? So every time that you get a tube in your hand, you're getting a real patient. And I know you can't see their face. Sometimes you just briefly look at the name and the age, perhaps maybe the diagnosis of the patient. But one thing to keep in mind is that you're actually helping somebody, okay? And you're doing something that is really rewarding. It is a privilege to be able to have the knowledge to do this type of job. You are contributing to improve to the improvement of this patient's quality of life. Okay, therefore, because this is the job, the standards are going to be very, very high. So we like keep you up here in terms of the standards. So it will require a technical competence plus superb people skill. Okay, so again, don't think that just because you're in the lab, you're not going to be talking to anyone. It's false. Okay, you do have interaction. You will have interaction with your co-workers, first of all. And then you'll have interactions with people on the floors. You'll have interactions with the nurses, with the PAs, with the physicians, you have interaction with your pathologist who run the lab. So you do have to have the ability to communicate with people, okay? Personality characteristics that enhance your ability to interact effectively with other people are very, very important, okay? So what are those some characteristics that will enhance your ability to interact effectively with your coworkers? So perhaps you are always willing to help, right? Maybe you always have a smile in your face, even though, things can get a little stressful sometimes. You are always doing the right thing by the patient. You have integrity, right? Integrity is basically doing the right thing when no one is watching, right? So there's some personality traits that you must have in order to be able to communicate effectively with your coworkers and also with other healthcare workers that are going to be coming to you for help, for test results, and to clarify, perhaps to clarify some questions that they may have. There are some soft skills that reflect personality characteristics, and these are distinctive individual qualities of a person that are relating to patterns of behavior and attitudes. And these skills enhance your ability to interact effectively with other people. Okay. So hard skills will enable you to perform the hands-on technical duties of your job, and soft skills are a part of your personality, but more difficult to acquire and change. Employers, such as employers like Valley, will screen, hire, pay, and promote the soft skills to ensure that employees work harmoniously with other people, and that is very, very important. Okay, so healthcare is unique, okay, is critical. We deal with life and death 24/7, 365 days out of the year. There is a rapid change which produces new devices, drugs, and medical procedures. It is important to form networks, restructuring organizations, and redesigning jobs. And it's also important to address labor supply concerns. So healthcare, the healthcare industry is perhaps a very, very unique industry. Change is always coming, okay? You never remain stagnant. You're always learning. You're always learning something new. And the best example of all of that I can give you is what's happened in the last 4 to 5 months with the whole coronavirus pandemic. This is a hospital, the hospital that you're doing your medical life science program, that is a pretty decent sized hospital. It is considered a community hospital. It's freestanding. It was in great financial situation before the whole pandemic occurred. And policies are in place. Everyone's working to protect the patients, and boom, this whole coronavirus happens, right? And it really, really, really did hit the community very, very strongly, because nobody was prepared for this, right? We did not know that this was going to be something that was going to lead to so many positive cases, so much chaos, so many deaths. For a lot of us, the deaths that occurred were close to home, right? And we were not expecting that. And in the healthcare community, especially in this hospital, everyone that worked in every single department had to have the ability to change quickly and to adapt. So these are the rapid changes that occur in healthcare. And I am very sure that everybody that works in this hospital went through all of this. In terms of trying to figure out how we're going to handle the COVID patients. How do we handle the ER patients? How do we handle the testing? What kind of testing are we going to do? Where are we sending the testing? How do you interpret the results? There's so many things that happened, right? And I think they're still happening, but they're more manageable now because we're really into the fifth, right? The fifth 6 months. Well, yeah, I would say the fifth month into this coronavirus situation. But other have it really bad. Other states are really still suffering from it, and the numbers are still going up. So the uniqueness of this is that you have to have the ability to adapt. You have to have the ability to create new things, to pivot, okay? And I think we all have to do that. And so healthcare, as much as it can be rewarding, a very rewarding career, working in healthcare, it could also be a very stressful career. A lot of the people that worked as healthcare professionals during this pandemic were putting themselves and their families at risk. Many people couldn't go back home. They had to isolate themselves from their families for a long time. And that was probably very painful. It was also very difficult seeing people that were passing away alone without their families. And for a lot of people, these healthcare workers were actually their family, right? So now you've become someone's family. And this is why it is such a rewarding career, yet it could be very stressful. Okay, so again, you have to have the ability to adapt to new things, to new challenges. So healthcare as a business. Workers must be aware of changes and where things are headed, to be well informed and to be prepared for the future. So it is very important that we understand the business of healthcare, you know, the funding, where is the money coming from? How are patients paying for the services? Who is paying for the services? The different types of insurance that are out there, the PPOs, the HMOs. So it's important for all of us to understand what goes on. Healthcare has become a very controversial industry with multiple issues and concerns under debate. We must retool the system to provide affordable healthcare for everyone. And one thing that is very true and very unfortunate about this country is that our healthcare system is broken. There is certainly a better way to do this, yet it hasn't been figured out. President Obama, when he was in office, he tried to do some healthcare reform by implementing Obamacare, where people had to purchase some sort of insurance so that we don't have millions and millions of Americans uninsured. Now, when President Trump came into office, he said we will repeal Obamacare. I'm not sure that has been the case just yet, but perhaps maybe in the next 4 years it will get done. I'm not sure. But healthcare is very controversial because for some reason America has not been able, or the United States has not been able to get it right. Okay, we do not have universal healthcare, as you know. Other countries such as Canada and many countries in Europe do have universal healthcare, and also many countries in South America have it as well. It is definitely a very, very difficult task to take this healthcare and reform it, and nonetheless take it into or turn it into a universal healthcare system. It is not as simple as people think it is. Right now, we are dealing with some Medicaid and Medicare services, and also dealing with private insurances. Okay, so workers basically need to know about the business side of their industry and where they fit in. Healthcare affects everyone, Consumers are the people who purchase or use a product or service, right? So we work as healthcare workers, but we also use healthcare, right? So we also get sick. We also go to the hospital. Our dependents go to the hospital. So we need to know how everything works, the business of it, and how it works, in order to understand what we're paying for, and to understand how our hospital works. It does, the way the healthcare is set up, it affects everyone. It affects our children, our children's children. It affects our parents and our parents' parents. So it affects everybody. So everyone must be aware. Taxpayers fund Medicare and Medicaid. Okay, so I'm not sure if you're familiar with these, but these are two entities that provide healthcare. Medicare is a government program that provides healthcare primarily for people who are 65 and older. Medicaid is a government program that provides healthcare for low-income people and families for people with certain disabilities. Okay, so when you get Medicare, you're eligible once you're 65 and over, okay? So keep that in mind. So when you're under 65, you must have healthcare from your employer, or you must purchase your own healthcare if you want to have healthcare at all. In terms of Medicaid, Medicaid is offered to low-income individuals and their families and people that have certain disabilities. Medicaid has a branch that covers children as well, children of low-income families. And under Obamacare, I believe, Medicaid was expanded to many other Americans that previously would not be qualified to get Medicaid because they would earn a little bit more. It would take them out of the bracket. But under Obamacare, that was expanded. So that was called Medicaid expansion. So that it can provide it can provide healthcare for maybe a couple of million people after that. Okay, so the US spends more on healthcare than any other developed nation, with costs rising about 8% a year. Unpaid medical bills are a leading cause of bankruptcy in the US. The cost of healthcare is growing faster than the cost of most other goods and services in the US. Unfortunately, as I mentioned before, this is a broken system and it must be fixed. There is no right or wrong answer. It is a very difficult task to get this together, and it has to be first in the agenda because healthcare is so important to so many of us. The rising costs of healthcare are due to salaries and benefits for healthcare workers, medical research, devices, and the cost of drugs, technology, equipment, and patient supplies, building construction and maintenance, training future doctors and other healthcare professionals as well. There are efforts being done to try to control for these rising costs, and these are gatekeepers to monitor and control access to care, to encourage the prevention to avoid medical conditions. So more preventive programs are offered, to provide care in these expensive settings, to avoid unnecessary or duplicate tests and treatments. And I'll go back to this in a second, and to coordinate services among providers. It is going to be very, very important, and this is an issue that has been ongoing for many years, to try to avoid unnecessary or duplicate tests and treatments. A lot of what was going on, many years ago, and it still goes on a little bit today, but there's more checkpoints today, more people that are working together to figure this issue out is the under or the over utilization of certain tests. So as you may know, lab tests, right, are not very cheap, right? So they will cost money. They cost money to the patient, and they will cost money to the hospital, right? So there are people that put together some task forces, right? Some committees to try to control for the overutilization as well as the underutilization of certain tests to really save money to the patient and save money for the hospital. So there is a career specifically for medical lab scientists. So you can be a medical lab scientist or a clinical laboratory scientist, and you could also get a master's degree, right, in clinical laboratory sciences. But beyond a master's degree, you have the opportunity to get a doctorate degree, a doctorate in clinical laboratory sciences. This doctor is someone who does exactly this. The person is in charge of going to all of the rounds with the physicians to making sure everyone, okay, is getting the appropriate testing that they need to get. Sometimes doctors just order a test and order another test, and they want to get a really nice picture of what the patient has. However, they're trying to get to point C, but they're completely going from they're completely skipping point B to get to point C, right? So they're going all over the place before they can get to point C. So the point is that this person is there to be a gatekeeper to make sure that the tests are getting done in the correct way so that the patient doesn't spend their money unnecessarily, and also the hospital. And also this person is making sure that the tests are all utilized and we're using the correct test to get to the correct diagnosis the best possible way. So this is a doctor in clinical lab science, and it's actually a position that was created, I would say, maybe about 10 years ago. And the person who was the first DCLS that graduated in this nation, her name is Dr. Gonzalez. And Dr. Gonzalez graduated, I believe, in May of 2018, I believe, so 2 years ago. Okay, so access to healthcare is very important as well. So we want to have a good healthcare system, and we also want to have access to the system. It will ensure adequate, it is important to ensure adequate access to healthcare services. And this is also an issue. Millions of Americans don't have healthcare insurance, right? As you already know, patients do without prescription drugs and don't have access to prenatal care. And this can be an issue, obviously, for pregnant women because they can't get the correct or the proper care or prenatal care for their pregnancy and eventually their babies. So ensuring adequate access to healthcare services is an issue, and that is very important. That is an aspect of our healthcare system that is also broken, and it needs to be fixed. The access to healthcare in underserved areas is much lower than what it would be like in well-served areas or suburban parts of the states. So there are people that are largely at a disadvantage, and they do not have the same access to healthcare that perhaps you and I have. So millions of Americans do not have healthcare insurance. There are millions of Americans that perhaps don't have access to private insurance or cannot afford to buy their own insurance, yet they are not in the lower income bracket to qualify for Medicaid services. So there's this huge gap between the lower income folks and then the middle class that still cannot close because we don't have the correct system in place. Okay, so unfortunately, if you like healthcare insurance, you're more than likely do not have access to prescription drugs, and that poses a huge problem as well. There is a lack of doctors and medical facilities in rural areas and in medically underserved urban areas, which also limits the access. It is difficult to recruit and to retain a sufficient labor supply in some parts of the US. So this is completely true. There is a huge lack of doctors and medical facilities in underserved urban areas. And these are the people that perhaps need healthcare the most, right? And so there is a complete disadvantage and many healthcare disparities within the people that live in poorer, income areas. So there are consequences. There are consequences to people's health when you are, a poor person. Okay, when you don't have access to healthcare, when you don't have access to insurance, when you don't have access to prescription drugs, and when you don't have access to good nutrition. Okay, so all of that is tied together. Not having the ability to go to a doctor, not having the ability to access a hospital, it will make you sicker and sicker and sicker. All right, so now let's talk about the baby boomer population. This is the elderly population that is growing rapidly due to the aging of baby boomers, right? The baby boomer population. 78 million people were born between 1946 and 1964. The over 65 population will almost double in coming years and will have a major impact on the demand for healthcare services. So healthcare systems have to be ready for an aging population. To be ready for aging and a plethora of different conditions and diseases that we will be dealing with. In the US healthcare system is one of the best in the world. However, it lags behind other countries in key indicators, okay? And some of these indicators are life expectancy and infant mortality rate. Life expectancy is the number of years of life remaining at any given age. So that's the number of years of life remaining at any given age. And life expectancy had improved, but has declined over the past few years as a result of the opioid crisis and the deaths associated with overdoses. Comparable countries to ours have life expectancy of 82 years. This is Japan, Singapore, Iceland, Canada, France, just to name a few. And compared to the US, which the US's life expectancy is 78 years. So we are approximately 43rd on the list of rankings. In terms of infant mortality rate, that is the number of infants that die during the first year of life. The infant mortality rate is also higher in the US compared to comparable countries. 2014 statistics show 5.8 deaths over 1,000 live births compared to Switzerland and the United Kingdom, which show 3.9 deaths over 1,000 live births. Other key indicators include disease burden. Disease burden is a measure that accounts for both longevity and the quality of life, and has generally improved over the past quarter century, dropping 12% between 1990 and 2017, with particular improvement seen for circulatory diseases. However, in the past few years, the disease burden rate has worsened in the US, similarly driven by substance abuse disorders, as well as an uptick of injuries. Okay, so let's talk about healthcare reform a little bit, okay? So what is healthcare reform? This is, again, a very controversial topic. A lot of politics can get into this as well. So everyone has their thoughts about healthcare reform, and I think it is very important to talk about it and to discuss it. It is very important for everyone to have their own opinion as well. So it is a controversial topic, but it's very, very pertinent to healthcare workers to stay informed about healthcare reform. So reform is an agreement that improvements are needed to control costs and increase access to healthcare. There is lots of disagreement and controversy about how to improve things. The Patient Protection and Affordable Care Act, which is the ACA, right? Affordable Care Act, was passed in 2010. The point of this was basically, it had three different goals. It was first off to make affordable healthcare insurance available to more people, okay? It was passed by law, and the law provides consumers with subsidies or premium tax credits that would lower costs for households with incomes between 100% and 400% of the federal poverty level. It would also expand Medicaid programs to cover all adults with incomes below 138% of the federal poverty level, and not all states did expand their Medicaid program. And also, it was important to support innovative medical care delivery methods designed to lower the cost of healthcare in general. So, healthcare reform that was implemented in 2010 had these revisions. It wanted to make, overall, it wanted to make healthcare affordable, and it wanted to expand healthcare for more people. These are some healthcare reform terms that you should be familiar with. Pre-existing conditions, and these are medical conditions that a patient had before applying to healthcare coverage. Individual mandate. This means that it is a requirement that everyone must have health insurance or be subject to a penalty tax. Defensive medicine. Defensive medicine is a medicine practice in such a way as to reduce the risk of malpractice litigation, typically by the use of excessive diagnosing testing. Capitation is the payment of a fee or grant to a doctor, school, or other person or body providing services to a number of people, such as the amount paid is determined by the number of patients, students, or customers. Single payer system is a type of universal healthcare financed by taxes that covers the cost of essential healthcare for all residents, with costs covered by a single public system. And lastly, you have universal healthcare, which is a healthcare system that provides healthcare and financial protection to all residents of a particular country or region. So with health care reform, there were some new healthcare organizations. There is the Healthcare Exchange, medical homes, and accountable care organizations, the ACOs. The Healthcare Exchange is an online marketplace where consumers can compare and buy individual healthcare insurance plans. Medical homes were organizations that provided comprehensive, coordinated healthcare to patients who are members. Accountable care organizations were networks of providers that work together and share responsibility and accountability for managing all healthcare services for at least 5,000 Medicare patients over a minimum of 3 years. Okay. So in terms of healthcare reform, where do you stand on the efforts to reform the nation's healthcare system? What role, if any, should the government play in healthcare and reform? Should taxpayers cover healthcare for poor people? Should people be required to have health insurance or pay a penalty? So these are super controversial topics, and perhaps these are some questions that you want to think about. We could also have a discussion about this when we talk about our case studies, but really reflect on this and see, what do you think about healthcare reform? What do you think about what's currently happening with our healthcare system in our country? What do you feel, what do you think about having universal healthcare, if at all possible, right? So these are just some questions that should make you think a little bit, right? Okay, so quality improvement in healthcare, super important point. It is improving the quality of healthcare services, which is a top priority for all healthcare workers. CQI stands for continuous quality improvement. These quality improvements are ways of using methods and tools to identify, prevent, and reduce the impact of process failures. By studying the process, you can determine if there is a better way to do things. CQI applies largely to preventing patient deaths by medical errors. Okay, so medical errors are one of the top reasons why people die in healthcare settings. And continuous quality improvement, or implementing methods and tools to identify and prevent medical errors, are set in all hospitals, especially in our hospital, to try to reduce medical errors to a very, very, very minimum. Here are some quality improvement goals. The goal of quality improvement, one of them, is to eliminate adverse effects such as patient falls and bed sores. We want to reduce unnecessary expense, such as keeping patients in the hospital longer than necessary. We want to prevent undesirable patient outcomes, such as hospital-acquired infections or medication overdoses. PDSA is an approach to improve these processes. PDSA stands for plan, do, study, right? This is study and act. This is more widely known now as PDCA, which stands for plan, do, check, and act, okay? In our hospital, we have the SBAR, SBAR, okay? This means we identify situation, S stands for situation, B stands for background, A stands for assessment, and R stands for recommendation. This is a technique that can be used to facilitate prompt and appropriate communication. This communication model has gained popularity in healthcare settings, especially amongst professions such as physicians and nurses. So, plan, do, study, and act in our hospital is called SBAR, SBAR. So in plan, you want to create a plan or a test to see how a different approach could work. Do stands for implementing the plan to see what happens. Study stands for reviewing the results to determine what was learned. And act means taking action based on what was learned. Metrics are important. Metrics are a set of measurements that quantify our results. So we must use our metrics to analyze the results to make sure that what we implemented has actually worked. And baseline data is information that is gathered before a change to better understand the current situation. Outcome data is the information that is gathered after a change to examine the impact or the results. Patient safety is also very important and super key in a healthcare setting. Patient safety is ensuring that the patient is our key goal. Everything that we do it for the safety of our patients, right? Even if you're working in the laboratory, you're working with a tube that belongs to a patient. So patient safety, medical errors are the third leading cause of death in the US alone, in the US alone. It is very important, okay, that we take this into consideration. It is very important that we understand, that we interpret, and that we don't estimate incorrectly. 1 million people are injured, and about 98,000 individuals die each year due to medical errors. This happens because something has been done incorrectly through ignorance or carelessness. This is a point that I'm going to stress throughout the year to you guys. There is no room for mistakes, okay? So we have to be, like we always say, on our toes 24/7 when we are working, no matter what is going on with our lives. We cannot let our outside world impact what we are doing at work. We have to somehow learn how to separate, okay? Our lives will always be impacted by something. Not everything is always kumbaya and I'm happy, I'm always happy, I'm always smiling. There's always something going on with people. And so as healthcare workers, we have to be able to separate our emotions, and we have to be able to come to work and be able to focus on our patients. And so it is so easy, so unbelievably easy to make a mistake. You guys are going to be doing so much with this blood work that you're going to be given, okay, by the phlebotomist. You're going to take it, you're going to process it, you're going to input information in the computer, you're going to put tubes in racks, you're going to load them into instruments, you're going to do so many things from step A to step Z. And then your ultimate goal is going to be to release these results to the physicians so that the physicians can look at these results and make a decision about their patients. So how much are you contributing to the patient's care? A lot, okay? They say that over 70% of medical decisions are made through the laboratory or diagnostic testing. So they need your results. Whatever you are giving, you are needed, okay? So there is no room for mistake. There is no room for medical error. Sadly, it happens, okay? And it is the third leading cause of death in the United States. So we have to do what is right, and we have to always try to focus so that we avoid mistakes. And avoiding mistakes, you are going to learn step by step, because we are going to be with you every step of the way until you become a medical lab scientist. Okay, so workers must speak up if they see a mistake or error about to occur. We must prevent a sentinel event, which is an unexpected occurrence involving a death or serious physical or psychological injury or the risk thereof. The National Patient Safety Goals provide specific actions to prevent medical errors. Just so you know, there are guidelines and there are programs in place, especially in the laboratory, to prevent error as much as we can. For example, we'll take blood bank, right? Blood bank is one of the areas in which there is absolutely no room for mistake, okay? So you will do types and screens on patients, which means that you're going to check their blood type, you're going to screen for antibodies, and once you find antibodies, you check for specific antibodies, okay? So these methods have now been computerized so that we could reduce medical errors as much as we can. Why? Because giving someone the wrong type blood could potentially kill them, okay? So there are different levels of transfusion reactions that you will learn about later in your courses. However, if I'm type A and I get type B blood, okay, I can have a serious transfusion reaction and die within minutes, okay? Also, there can be some serious transfusion reactions if I am given a blood that has an antibody that I have the antigen for, okay? So my body will have a reaction to that. So the way that we try to reduce this errors is, yes, we're gonna work up our patient and we're gonna try to do it correctly, but we have checks in the lab, okay? Checks that are within our LISs, our laboratory information systems, that will prevent us from making these errors, okay? So as we move along, we're going to learn a little bit more about what goes on in the lab that would help prevent certain errors. Okay, so let's talk about the workforce, supply, and demand. Okay, so this is a long one, right, guys? Bear with me, we're almost there. Okay, so there is insufficient staff, including nurses and other workers. And this can be a huge huge why medical errors are being done or are getting done or being made. The lack of staffing, it's huge for nurses, but it also happens in the lab, okay? So I always try to take our examples to the lab because this is where you're gonna be. Puts a higher workload on other people, which means that one person, instead of handling what they're used to, your typical bench, and your differential counts, now they're covering maybe 2 or 3 benches at the same time, and perhaps they're working with just one other person or maybe alone, and so the work increases and increases, which means their stress level increases, which means that they could potentially make some sort of error. Okay, so insufficient staff, including nurses and other workers, can lead to serious quality and safety concerns. Millions of baby boomers who work in healthcare will be close to retirement, and you may also see this happening in the lab. There are some older med techs that are now getting ready to retire. I think we just had one person that retired, and we're having another person from core who's going to retire as well. You don't know them yet, but you'll see that that's going to start happening very soon. And there's going to be some sort of medical lab scientist shortage. And there will be more and more and more as baby boomers are increasing the demand for, as they leave the lab, there's going to be a higher increase in the demand for healthcare services, and also a higher increase or higher workforce shortage as well. 55% of RNs, registered nurses, will retire in the next 10 years. A shortage of 1 million nurses will occur by 2020. Could you imagine what's happening right now with the whole coronavirus situation? The supply of newly trained RNs is not sufficient to replace retiring RNs, and there is already a serious shortage of geriatric doctors. These are doctors that specialize in healthcare for the elderly patients. Okay, so now that you know a little bit about this, but we've moved on from, your typical paper charts, right, into electronic medical records. Now we have all these healthcare portals that we can log into, which is great. We also have our LIS systems that integrate the laboratory instruments to the patient's chart, so that everything can be computerized. Electronic medical records, EMRs, are used in hospitals, doctors' offices, and clinics, where patients' information needs to be shared quickly and frequently among providers at several different locations. Just so you're aware, this wasn't the case before. If you were going in from one doctor to another, you had to either go to the records office and one doctor to get your records and then bring them to the other doctor. Now, it is completely different. If you're under the same healthcare system, for example, if your doctors are getting seen, if your doctors are all from Hackensack Meridian Health, they can just go by your name and pull up all of your recent blood work, all of your diagnosis, if you had any hospitalizations, everything will be able to be in one screen, and you can see it from one doctor to the other. Now, if you have two different doctors from different healthcare systems, or I guess a family of systems, you may still have to try to acquire your medical records and then bring them over with you. But at least the situation is getting a little bit easier. We still don't have one system where everything is accessible in a cloud. Other countries certainly have that ability, but we are not at that place just yet. So as patients move along, among providers, their medical information needs to be accessible wherever they receive care. So it would be ideal to be able to, bring up patients' information anywhere you went. And it can happen as long as you're within the same umbrella of doctors. When providers can access comprehensive, up-to-date information on each patient, the quality and continuity of care increases, and the cost associated with unnecessary duplication of blood tests and radiographs, for example, decreases, right? So if I have all of your information from your cardiologist and I'm your primary doctor, I can see everything that was done in the cardiologist. I do not need to run an EKG. I don't need to run an ultrasound, right? So I have all that information already. If I am a primary doctor and I'm trying to assess your blood pressure medication, but you're having gastrointestinal issues and you just finished seeing a gastro, and we're under the same umbrella of healthcare providers, if I go to your chart, I can see that you just did a whole GI panel, that you had an infection, that you were given antibiotics, and so I can treat you based on all that information. So it is important to have the information under an electronic, some sort of electronic medical record. There are some disadvantages, of course. It is difficult to take time to train the staff and make some transitions from paper to electronic. Not all EMR systems work together. So again, if you're under the same family of healthcare workers, right? Like Barnabas Health, for example, all the doctors that belong to Barnabas Health will be able to pull information. All the doctors that work for Hackensack Meridian Health or Meridian Health will be able to pull information. So not all EMR systems work together. There are concerns about a electronic breach, right? A break, failure, or interruption in patient confidentiality, which is maintaining the privacy of certain matters. So it is very important that because it is all online and in this cloud, that we still remain confidential with our patients, and hope that there is no hacking, but hacking occurs, of course, and that patient information doesn't get out. Also, one thing to keep in mind is, if you work in a hospital system and someone is getting treated, you do not have permission to just go up and put the medical record number or look up the patient by their name and last name, just because you're in the hospital. You are not treating that patient, so you certainly do not have access to it unless you're working with the doctors to treat that particular patient. So make sure that you adhere to all the confidentiality and the HIPAA rules that have been taught to you at the beginning of this program. Okay, so the big picture. Okay, so think about some of these questions. Where do you fit into the big picture? You wear at least 3 different hats, right, in healthcare. You're a patient, you're also a taxpayer, and you're a healthcare professional. So what do you think, what is your point of view as a patient, a taxpayer, and a healthcare professional? Each time you change a hat, your perspective will change, okay? This is the way, a perspective is the manner or the way in which a person views something. At work, your patients must come first, okay? So no matter what your values are, no matter what your political stance is, where you stand as a taxpayer, where you live, okay? When you're working, when you're in a healthcare setting, you have to remember that every tube that comes into the lab is a patient, and the safety of a patient comes first. You have to keep in mind, you always have to remember that your results are going to impact this patient, and the physicians and the nurses are waiting on your results, okay, so that they can make a decision on the patient, on how they are going to continue to treat the patient, how they're going to monitor the patient once the condition has been found. So what you do as a healthcare worker is very, very important, okay? And with that said, I will end this lecture with some key points from this lecture. Remember that soft skills are just as important as hard skills in achieving success at work. Keep up to date with the business side of healthcare and where it appears to be heading. Monitor current trends and issues so you can discuss them intelligently with other people. Be on the lookout for new technology and how it might impact your patients and your work. Apply PDSA approach or the SBAR approach as it is used at Valley, and statistical measurements to improve the quality of care, and monitor the national patient safety goals and avoid potential mistakes and errors. Speak up and question the actions of others when something doesn't seem quite right. Learn as much as you can about caring for geriatric patients. Embrace new technology such as electronic medical records and the benefits that it provides. Think about the different hats you wear and always put your patients first. Consider what role you want to play in healthcare and keep learning. This case study, we are not going to work on this together. You actually have case studies that have been provided to you already, so you can start working on those as soon as you feel comfortable. And ends our lecture for today.